Nutritional guidelines and dietary restrictions for gout. What exactly is gout? Gout is a form of arthritis caused by an excess of uric acid in the blood. Excess uric acid can cause a buildup of fluid around the joints, resulting in uric acid crystals. These crystals cause the joints to swell and become inflamed, resulting in excruciating pain. The good news is that gout can be managed, aside from medications. Dietary and lifestyle changes can aid in the prevention of painful attacks. A gout-friendly diet is specifically designed to aid in the prevention of painful gout attacks. Find out which foods to avoid to help prevent symptoms. What is the cause of gout? Gout occurs when there is an excess of uric acid in the blood. This excess uric acid may be the result of a purine-rich diet, or your body may simply produce too much uric acid. Although blood uric acid levels may remain normal in some cases, gout is still the correct diagnosis. This is caused by inflammatory factors as well as the body excreting excess uric acid in the urine. Understanding purine. Purines are chemical compounds that, when metabolized, degrade into uric acid. Purines are either produced by your body or ingested through the foods you eat. Purines are normally broken down into uric acid. After that, the uric acid is dissolving in blood, passed into the urine by the kidneys, removed from the body. This isn't always the case with gout. Complications occur when the kidneys do not excrete uric acid quickly enough or when there is an increase in uric acid production. These high levels accumulate in the blood, resulting in hyperuricemia. Though not a disease, hyperuricemia can be dangerous if it results in the formation of uric acid crystals. Gout can occur when these crystals accumulate around the joints. Which foods should you avoid? A gout-friendly diet can help control uric acid levels in the body while also improving overall health. According to the American College of Rheumatology, a diet high in the following foods can lead to gout: seafood, meat that is red, sugary drinks, alcohol. All of these foods are high in purine. Keeping this in mind, a gout diet should avoid or limit the following foods: brain, sweetbreads, heart, kidney, and liver are examples of organ meats. Bacon, turkey, lamb, venison, sardines, herring, anchovies, and smelt, tuna, mackerel, trout, haddock, and codfish, scallops and the mussels, yeast, beer, wine, juices from fruits, soda. Only a moderate amount of animal protein should be included in your diet if you want to include it. It is recommended to limit your consumption of purine-rich meats. A typical serving of meat is 3 ounces, while a serving of fish is 4 ounces. Gout-friendly recipes either do not contain any of these animal proteins or have amounts that are small enough to help you stick to 1 to 2 servings per day or include meatless days. How do animal proteins affect gout sufferers? Purines are abundant in animal proteins. Because purine accumulation can result in elevated levels of uric acid, which can lead to gout. It's best to avoid or strictly limit these foods. These foods are high in purines and should be consumed in moderation: beef, grouse, mutton, pork, ham, chicken, partridge, pheasant, goose, duck, salmon, crab, lobster, oysters, and shrimp. While these proteins contain fewer purines than those on the previous list, you should still try to limit your daily intake of all animal protein to 3 to 6 ounces, or 1 to 2 servings. What effect does alcohol have on gout patients? Alcohol interferes with the removal of uric acid from the body. This disruption is thought to be caused by high levels of purine in alcoholic beverages. Purines are normally broken down into uric acid and flushed out of the body through urine. This process, however, is halted when uric acid levels become too high. Gout develops when crystals form around the joints. Follow these guidelines to avoid future gout attacks. When having an attack, stay away from alcohol. Limit your wine consumption. Avoid beer. Remember that unless your doctor tells you otherwise, you should avoid all alcohol. These alcohol restrictions are also taken into account in gout-friendly recipes. What effect does sugar have on gout patients? Consuming a lot of fructose and sugary foods may raise your uric acid levels. One reason is that sugar and sweets are high in calories and have been linked to obesity, which is a known risk factor for gout. Furthermore, while fructose-rich beverages, such as soft drinks, do not contain high levels of purines, they have been linked to an increased risk of developing gout. This is due to the fact that uric acid is a byproduct of fructose metabolism. Consuming a lot of fructose has been shown to raise uric acid levels in the blood. Increasing your daily water intake and reducing your consumption of soft drinks and soda will help to flush your body of uric acid and prevent the formation of kidney stones. Sweets, as tempting as they are, should be avoided. Instead, make room for gout-friendly foods like plant-based proteins and low-fat dairy products. Avoid or limit refined carbohydrates. Refined carbohydrates include white bread, cakes, candy. Except for whole grain pasta, all gout-friendly recipes are either completely free of refined carbohydrates or contain only trace amounts of them. What dietary changes can help with gout? It is critical to recognize that a gout diet is not a treatment. Rather, it is a change in lifestyle that can help reduce or eliminate gout symptoms. In addition to a gout diet, your doctor will most likely advise you to exercise regularly and lose weight. In many cases, this can help control gout more effectively than a low-purine diet. What is the main point? Gout, unlike other types of arthritis, can be cured. Treatment options will vary and will be determined by a number of factors, including your age, your overall health, your medical background, the seriousness of your condition. Acute gout attacks can be managed in addition to taking prescribed medications by diet, a healthy way of life, weight control, a proactive approach to symptoms and signs. Your eating and lifestyle habits will determine a large part of your success in managing your condition. Before you begin, make sure to discuss any nutritional concerns with your doctor and dietitian.